number 7. I counted about 10 or 11 incisions on my back. Can you talk a little bit about those incisions?
Absolutely. Now, for people who don't understand much about minimal invasive, even many of my colleagues, they think it's about size of the incision that makes this what we did minimal invasive. Whereas in the open surgery, we fillet you open. Here, we make incision and place those individual hardware and build the construct inside little by little. We usually use 1 or 2 incisions to put the cages in these 3 places. Then each of the screws need its own small little half-inch incision to put the screw in. The bottom 2 screws usually use the same kind of hole to get in. And then we use another incision to put that rod in place here. So literally we make lots of little incision and build the construct inside of you without really disturbing the muscle and cutting the muscle and cutting the bone. And those little incisions, they heal much, much better than one big incision. The fact that we don't strip the muscle of the bone, we don't take the blood supply of the bone away, make the bone heal much faster. We just did a study. We have a rate of fusion that is unheard of in open surgery, as well as by keeping the muscle alive, that helps you recover much faster. Now, those little incisions as well are separated, meaning if one of them get infected, the others don't get infected. So the risk of infection is much lower. But at the end of the day, let's put it the number. I think the statistic is important. Whereas in the open surgery, there is 3 to 5% of risk of infection. Our risk of infection is 0.3, meaning that from 800 patients that we have done surgery, only 2 of them got a little bit of infection on the skin, but they didn't even require any kind of opening or drainage or anything like that. We just give them antibiotic, and both people had extraordinary circumstances. So even though we have lots of skin incision, there are huge advantage of what we are doing by not disturbing the muscle, not killing the muscle, not denervating the muscle, and not taking the vascular supply of the muscle and bone away. And people heal much, much faster, as you are an example of that. You're just 1 month after a severe scoliosis. Usually after open surgery, this kind of result are expected within at least 3 to 6 months.
Gee, that's
Yeah.
something.
Yeah.
You know, other than bruising on his back, he had pretty good bruising. Those incisions look great.
Yeah.
They didn't, I mean,
And
they
that is,
healed
I think,
so
is
nicely.
important information
Yeah.
as well.
Yeah.
Because we don't put a drain, if there's some bleeding under the skin, that's what the bruising is.
Yeah.
Sometimes they can even sag down. They are at first blue, and then they turn sometimes
Yeah.
even black, and then after usually 2 to 4 weeks they go away.
Yeah, and it was more dependent.
Yes,
you know,
yes.
just down to the
That
floor.
you just described it,
Yep.
and that's good to have it as well for
Yeah.
people.